Hey guys, we have another video back for you today on youth and COVID-19. I'm a co-chair for the FEMA Region 6 Youth Preparedness Council. I'm also a member of FEMA's National Youth Preparedness Council. My name's Wyatt and I'll be your narrator today. Let's start by dispelling some rumors. One of the most popular rumors that is circulating right now is that youth can't get the novel coronavirus or COVID-19. This simply isn't true. In fact, we've seen statistics where youth have been getting the novel coronavirus, so there's no factual evidence to support that at all. Another claim is that the flu is worse than the coronavirus. We see that this isn't really true, and that especially this statement isn't accurate. While the flu has caused more deaths, the flu has also been around longer, even in just this season. And we don't have reports of all the cases of COVID-19 because some show so mild of symptoms that they're never recorded or that you can't get testing. So really, this isn't a supported statement that the flu is worse. In fact, the coronavirus is far more transferable according to the CDC and the World Health Organization. So in a lot of ways, really the coronavirus is worse than the flu. Another rumor is that COVID-19 isn't transferable if you're in a hot and humid environment, so that as we start warming up that this virus should die out. Well, the World Health Organization has come out and said that that just isn't true. And finally, one of the biggest rumors is that I don't feel sick, so I'm fine, right? Well, even if you don't show symptoms, you can still have the virus in you. In fact, some studies have suggested that some 15 to 20% of people who are infected with the coronavirus don't show symptoms anyways. And so even if you have it and aren't sick and never get sick from it, you still have the virus in you that you can spread to others. And that's especially a problem with others that have immune problems or who are your older relatives or friends. One of the biggest treatments that's out there to really try and prevent the spread of this is social distancing, because we know that there's no known vaccine and no proven medicines that help in the treatment of coronavirus. So what is social distancing? Well, Merriam-Webster defines it as the practice of maintaining a greater than usual physical distance from other people or of avoiding direct contact with people or objects in public places during the outbreak of a contagious disease in order to minimize exposure and reduce the transmission of infection. In other words, social distancing is really just removing yourself from social environments where there's crowds of people, where not only can you take a higher chance on contracting the virus, but if you have the virus in you, again, without showing any symptoms, it takes away the chances that you have the virus in you and you spread it to other people. Here's an interesting graphic on the power of social distancing. This is shared from Gary Warshaw. It shows that one person infects 2.5 people on average, and you can just see after 30 days how many people are infected with this virus. And again, that one person could be somebody that doesn't show any symptoms at all. But you see through less exposure, if you start cutting that number in half, that the number of people infected after 30 days goes down dramatically. And so that's really what the power of social distancing is that you remove yourself as much as possible from exposure to people, and I might add unnecessary exposure, such as a school setting or churches where you have a bunch of people in one area. You remove yourself from that and you don't spread that virus as fast, and that allows our healthcare system to not come overran. So some ways to practice social distancing. Well, number one, let's avoid large crowds. Again, the more you limit the people you're around, the better off you are of not only not getting the virus, but not sharing it if you do have it. Let's also not only limit the amount of people we're around, but let's limit the time that we spend with them. We know that this disease is spread through water droplet contact, so sneezing and coughing. So the less time we're around somebody, the less time there is for them to sneeze or cough to where we could potentially contract this virus. Then also, let's consider the health of family members. Remember, you may be asymptomatic from this. You may have it and have no symptoms or nothing that affects you. But you can still go and spread it to your family members, unbeknownst to you. And so this is especially something for you to consider when you have family members who are older relatives, older friends who are 65 or up that really cannot stand to have this virus in their system, that does not have the immune system to help support this. If you'd like more information, I'd recommend you to the Centers for Disease Control and Prevention, ready.gov, the whitehouse.gov, or the Department of Health and Human Services. Thanks for watching.